So I'm Dr. Peter Leung. I'm one of the obstetrician gynecologists working in the Sand Hospital. I'm also the consultant as well as the clinical director in IVF Australia as well as the Fertility Centre Liverpool. So during my care of the patients, it is one of the commonly asked questions by lots of audience or lots of patients is that, how we can prepare ourselves for a pregnancy. Because there's a lot of expecting mums and dads there. It's questioning their head, how they are best to prepare themselves for starting on having a baby. Now, there are a few things usually we suggest people to look at before they're embarking on a journey, all right? Because as an obstetrician gynecologist, we always talk about family planning. That means that you should be prepared before the pregnancy comes. So the first thing we usually talk about is obviously their background risks, whether they actually have a pre-existing condition that need to be looked at, in particular by their GPs or their obstetricians. Because sometimes, their medical illnesses sometimes could exacerbate problems during the pregnancy or developing other complications that may affect the development of the baby. Sometimes the medication they are taking can also affect the pregnancy, the chance of conception, as well as potential health of the baby as well. So these things usually need to be looked at by the doctors and making sure that those things has been optimized before the patients are embarking on a journey and getting ready for the baby. The second thing that we usually suggest them to actually adopt is a healthy lifestyle. Now that's obviously a very big thing, encompassing both the diet, the exercise, the drugs that you're taking, the smoking, alcohol intake, as well as the vitamin supplementation. Those are the things that usually we suggest people to look at before they are also starting to have that journey. Now the initial things is about the seeing your GP, where they would be in the best position to look at your whole overall general health. In particular, patients being a chronic smoker and drinker, those are the two things that we strongly advise ladies to stop in order to optimize the chance of a successful pregnancy as well as preventing complication happening. We have strong evidence to suggest that if you are being a chronic smoker, it will be bad for your health, it will be bad for your partner's health, it will be also bad for the babies as well, because everything you smoke through will be coming to the baby and will affect the growth of the baby as well as the birth weight. So it's really important that if you can, try to minimize smoking, or at all, if best you can do, to stop smoking if at all possible. Now at the moment, we can't recommend a safe alcohol intake for pregnancy. So that's why I know it's not fair for the girls, but any lady is actually planning for pregnancy, we should usually adopt zero alcohol intake. So despite the fact that there is not a very strong association between alcohol consumption unless you are drinking binge amount in a harmful way that's causing the pregnancy, there is no safe level that we can recommend at this stage. So that's why it is still a blanket sort of suggestion that you should not taking any alcohol during when you're planning for pregnancy. Folic acid intake is also very important in a sense to prevent urotube defects. Now I know that there's also lots of supplementation that's been recommended during pregnancy. If you actually go to the pharmacy, there will be a bewildering amount of medication on the shelf and the pharmacist will be telling you should take. Currently, the RANZCOG, which is the College of Obstetricians and Gynecologists, is only recommending people to take folic acids, iodine and iron. So those three are the key elements usually enticing a healthy baby to happen. And so we are strongly advising ladies to potential mums to be considering starting on those vitamin supplements if they haven't done so. It is also important to avoid using recreational drugs in this time. Obviously, any medication you're taking into or a potential prescribed medication, you should also need to check with your doctors to making sure that they are safe during the pregnancy. While you're seeing your GPs, they usually would do two more things for preparation to pregnancy as well. One of them is usually they would organize a blood test for you to make sure that your immunity is actually up to scratch, including checking such as the rubella, hepatitis, HIV, or syphilis screening testing. If you haven't have immunity for some of these potential infection agents, then sometimes the family doctors would advise you to update your vaccination prior for you to starting on the pregnancy. It is also perhaps a good time to update your pap smear as well at that time, because often lots of ladies has forgotten about having a regular checkup in terms of preventing the cervical cancer. So this is often a very good time to start your pap smear before the pregnancy happens. Now, the other things that people would be interested to know is actually when is the best time to have natural intercourse to achieve a successful outcome and getting the best chance of nailing the pregnancy. Usually, we suggest people, if they have a regular period, there's a few ways that you can try to pinpoint the time of ovulation. Some of them can be used using like a basal body temperature chart, where if they want to measure their body temperature. Sometimes you can monitor the raise of the temperature in the second half of the menstrual cycle. So if you actually have monitored your temperature for a few months, sometimes you can actually tell which date you would have your ovulation. Other ladies can actually notice the change in the cervical mucus, like if they notice the vaginal secretion would changes during the peak time of the ovulations. So sometimes they can actually use that as well as an indicator when they should have natural intercourse to increase the chance of a pregnancy. Now, if you're not bothering with that, sometimes the easiest way is also you can actually use some of the ovulation tracking apps, where you can put down your, the menstrual cycle, the length of your menstrual cycle, when your last menstrual period, and then usually they would roughly calculate the day of the ovulation for you, and then you can start the natural intercourse in the proposed time. There's obviously other means that you can check for your ovulation as well, including use of salivary test kit, urine test kits. Those tend to be a bit more expensive, and at the moment it hasn't have a strong evidence to suggest that using these kits is actually improving the chance of pregnancy as such. So usually as a start, when the couple is trying for pregnancy, I would refrain from asking patients to spend too much money on those kits, but rather just give it a go for 6 months to 12 months, and if they have trouble, then come and see the doctors and they will give them appropriate recommendations. So overall, it will be important for you to have early family planning, including to prepare the best of your health and optimize the condition of yourself as well as your environment as well as your partner's health in preparation for the pregnancy to come. This is encompassed through changes on your lifestyles, maybe seeing a GP to update the necessary investigation as well as your health check, as well as looking after everybody's health at the same time.